Stephanie, and I'm here in the procedure room at Flatrock Aesthetics. Today, our technician, Melissa, is going to demonstrate for you all of the laser services that we offer here. I'd like to thank Tammy, our model. She is our biller and works at the front desk. So let's get started. So as you can see, Tammy is goggled. We have to protect the eyes. She also has gauze in her mouth, between her teeth and her lips, to protect her dental work or any natural teeth that she has. Melissa just toned her skin. We want to make sure that we don't have any oils or makeup or debris on the skin when we're doing the procedure. We're applying clear ultrasound gel. That helps conduct the heat. It also helps protect the epidermis from the laser beam that we're administering. So this procedure is skin rejuvenation. Skin rejuvenation is great for fine lines and wrinkles, for acne, scars, rosacea, some pigment discoloration. And as you can see, we're just administering the beams across the skin. During this procedure, the handpiece never actually comes in contact with the skin. And so what it's doing is penetrating the surface. It's going down where your collagen and your elastin's at. We want to reproduce collagen. That way we can bring that collagen to the surface and minimize your fine lines and wrinkles, smooth out your scarring, pull all those impurities out of the skin. How we doing, Tammy? Thumbs up? As you can see, effortless, painless. Actually, people find this very relaxing. Awesome. Okay, while we have Tammy goggled up, we're going to perform our IPL service. It's Limelight, and what this targets is skin discoloration. So if you have sunspots, age spots, melasma, those types of things, we're able to treat that real easily. So Melissa, again, is toning the area. As you can see, we have the little spot circled that we're going to do the treatment on for you today. And due to the fact that we only have one set of IPL goggles, and Melissa has those, Melissa's going to count off before she actually administers the beam. So our camera person and myself can close our eyes. We can't actually be subject to the beam. So what we do is when we're treating individual spots, we just take a clear, clean piece of paper, we hole punch it, and that way we're only actually treating the spot. But if you have skin discoloration, which is kind of all over the place, we can actually take the whole crystal to the whole area. So we can treat your chest, your face, your whole arm, but for today we're just treating an individual spot. Melissa, whenever you're ready, count them off for us.
All right, 1, 2, 3.
Perfect. I'm going to do one more for you.
On the count of 3. 1, 2, 3.
Nice. All right. And Tammy, any discomfort? Nice.
Done.
Perfect. All right. So we're going to clean Tammy up and we're going to turn her over. Next, we're going to show you our vein therapy. We can do vein therapy on your face for broken capillaries. We can treat those unsightly spider veins on your legs. Tammy has had a few spider vein treatments already, so her veins are very light. We do have one circle though that we can show you today. And again, Melissa's going to put some clear ultrasound gel on the site. And our handpiece has a copper cooling tip. So what she's going to do is she's going to actually cool the site first. That kind of reduces the possibility of overexposure. It kind of numbs the area, makes it a little bit more tolerable. And then after the procedure, she cools it afterwards. And so what we're doing is we're actually trying to dry up the blood within the vessel. When that happens, the vessel collapses and then the body absorbs it naturally.
Here we go. Here we go.
Nice. Good job. All right, moving on. We're going to do one of our most famous procedures, most commonly done here, is our laser hair removal. So if you have unwanted hair anywhere on your body, we can remove it for you. Again, we'll tone the site. Apply our clear ultrasound gel. This actually, for this procedure, helps us be able to glide the handpiece over the skin. Okay, again, so Melissa's going to be pre-cooling the site, and as she's doing one section of the skin, the handpiece is actually cooling the skin prior to the administer of the beam.
Here we go, Tammy.
So what happens is the laser beam attaches itself to the shaft, the hair shaft. It goes down the shaft to the follicle, destroys the follicle, therefore hair can never grow there again. Sometimes we get ejection of the hair day of, like as we're doing the treatment. Sometimes it just destroys the follicle, and 1 to 2 weeks later, that follicle and that hair will work its way out the skin. Laser hair removal is a series of appointments depending on the part of your body. Depends on how frequent you come in. For your legs, it's every 10 to 12 weeks. And you want to come to the appointment clean shaven. We don't want any hair on the outside of the skin. The laser energy would concentrate on that hair, just burn the hair and not shoot down the shaft. And you know, we want it to shoot down the shaft and get to the follicle. So you want to come to your appointments clean shaven. All of our procedures here, you need to be off antibiotics and steroids 3 days prior to treatment. You need to watch your sun exposure, but as you can see, it's very easy and very tolerable. Nice. Thanks, Melissa. All right, so next what we're going to demonstrate for you is our nail fungus removal. Fortunately, Tammy doesn't have nail fungus, but for the sake of the video, she's volunteering to use her nails for us. So same thing, we're going to be administering the beams to the tissue around the nail and the nail. Nail fungus is very hard to remove, but we're finding great success with the laser treatments. You do need to do really good home care, which would involve an antifungal spray for if you're doing your toes and your shoes. You want to use some kind of topical. You need to take care of that at home in between treatments. Your nails take a long time to grow, and so it might be a little while before you actually see the clean nail. It is a series of visits. You could use, you could need up to 3 visits to 6 visits, just depending on, your fungus. Okay, so no gel applied here. We want that raw, straight laser beam right on those nails. And so we administer so many pulses to each nail. If at any time it gets a little sensitive, we apply a little bit of pressure, and then we resume our pulses, as you can see Melissa doing. Again, very tolerable, very easy. Perfect. Thanks. So I hope you enjoyed our little video today. I hope you found it very informative, and we hope to see you on our table soon. Thanks.